and we're going to be reviewing progesterone and oil intramuscular injection with my patient.
Hi, I'm Morgan, and I'm going to be going through fertility treatments.
Okay, Morgan, so upon receiving your package of the progesterone and oil, you're also going to have a nice placemat, and it's going to visually allow you to see which medication it is. So here it's highlighted in green, and you're going to see it's the progesterone and oil. So when you're ready to use this medication, it's just stored at room temperature. You're going to take it out of the box, and then you have some additional supplies that you need to find for this one as well, okay? So you're going to have a bag, and it's going to be a 3 milliliter syringe attached to a 22 gauge 1.5 inch needle, okay? And on the bag that this comes in, it's going to be labeled, used to inject progesterone and oil, okay? Separately, you're going to have another bag of just needles, and it's going to be labeled 18 gauge 1.5 inch needle. And on that bag that this comes in, it's going to say used to draw up progesterone and oil. Okay, so that's all our supplies that we need for this one. The first thing that you're going to do is pop the safety cover off the progesterone and oil vial, and that gets discarded, that never goes back on. You're just going to clean the top of the rubber stopper with an alcohol swab before each use. Okay. Next, you're going to open the 3 ml 22 gauge needle syringe from the package. And the first thing that you're going to do with this is you're going to twist off the 22 gauge 1.5 inch needle, because this is the one that you're going to be using to inject. Okay, so we're just going to twist this off and set it aside. Then you're going to open the 18 gauge needle from the package, and this is the one that was labeled used to draw up progesterone and oil. So once you open this up from the package, you're just going to twist this one onto the body of the 3 ml syringe, okay? Your dose is 1 milliliter of the oil that you're going to be using. So you're going to pull back on the plunger of the syringe till you have 1 milliliter of air inside of the syringe, okay, or equivalent to whatever your dose specified from your provider was. So 1 milliliter of air. And from there, you're going to be ready to withdraw the oil from the vial. So to go into this vial, it's really important that we don't go straight in at a 90-degree angle, okay, because it would potentially put pieces of the rubber stopper inside of the vial. Okay, so we're going to go into this vial at a very exaggerated 45-degree angle. I hold it steady on a flat surface with my non-dominant hand, facing the bevel of the needle up, so that slanted side. Okay. You're just going to take your time going into the vial on that 45-degree angle, and then from there, you're going to push on the plunger to dispense the air inside the vial now. Every time you go into this vial, you do need to pick it up though and inspect it to make sure that there's no pieces of the rubber stopper floating around inside. Because if there was, it wouldn't be safe to inject into your body. You'd have to grab a new vial of the oil and then call us for a refill. Okay. So then you're going to turn the vial and syringe upside down together, leaving it on that same angle. And you're just going to pull back on the plunger until you have a milliliter of the oil inside of the syringe. Okay. You're going to turn it right side up. You're going to remove the needle from the vial. You're going to carefully recap that large 18 gauge needle and twist it off from the 3 ml syringe, and it goes into the sharps container. You're then going to take the 22 gauge needle that was labeled for injecting that originally came attached and twist that one back on. Okay. You're going to be using your buttocks. You're going to alternate sides daily between your left and your right butt cheeks. Okay, so to give you an idea of where we're going, you could imagine that there's a circle around one of your entire butt cheeks, then a giant plus sign dividing it into 4 quadrants, and you're going to be using the upper outer portion. Other side, okay? So once you select your site, you're going to clean the skin with an alcohol swab. And when you're ready, you're going to carefully uncap the needle. And you're going to spread the skin between your thumb and your index finger so the skin's nice and taut, okay? I'm going to spread it. Then you're going to go straight in with the needle all the way in at 90 degrees, but you're not going to inject it. We have to do something really important called checking for placement, okay? Because we want to make sure that we're actually in the muscle, not a blood vessel for absorption reasons. So to do this, once the syringe is all the way inside, the needle's all the way inside, you're just going to pull back on the plunger slightly to aspirate, okay? And if blood came into the body of the syringe, that just means that we're in a blood vessel. So we need to remove the needle from our body, and then you're going to apply pressure to that injection site, okay? Then you're just gonna switch out your 22 gauge needle, carefully recap it, twist it off from the 3 ml syringe, dispose that in the sharps container. So you would have to grab a new clean 22 gauge needle, okay? And you're just going to twist that onto the body of the syringe. And at this point, you may see a little bit of your own blood mixed with the progesterone and oil. That's fine. It's your own blood, okay? So you're just going to try to inject again, going 1 to 2 inches away from where you tried last. So once again, you would clean the skin, spread the skin, carefully uncap your needle. You're going to go straight in with the needle again, all the way in at 90 degrees. Once again, we're going to pull back on that plunger. And at this time, nothing should come into the body of the syringe. So that means that we're in the muscle, we're safe to inject and push our full dose, okay? So you're gonna push your full dose. You're just gonna hold it there for an extra 5 seconds after you've injected your dose, okay? Then you're gonna remove the needle from your body, and that whole thing goes into the sharps container. Okay, so when you remove the needle from your body, you may see a little bit of blood or leakage leak out from where you just injected. If that happens, that's fine. You just want to wash the area with a soap, pat it dry, and place a Band-Aid over it to localize any further leakage. Also, if the medication encounters your skin, I want you to be aware it may be itchy, but if you become extremely itchy, you see redness, swelling, hives near the injection site, that would be something to let your nurse know. Okay? It is also normal to feel a little marble or a pea-sized lump after you've done the injection. You just want to avoid injecting into those lumps in the future.